Hi, everyone. Good evening. Welcome to the Evoke Therapy Program broadcast. Tonight's a special webinar. We have a guest presenter along with me, and so I'm going to allow him to introduce himself and give you his background. But I will say that we crossed paths about 4 years ago when he had a child that went through our program, and then more recently has reached out to us to share with us some of his hard-earned wisdom of the insurance process and getting some insurance reimbursement for wilderness therapy. So I'll let him do most of the introduction. I'll be taking any of your questions and passing them along to our guest, Joe. And so you can submit those at any time, and I'll be on mute unless there's something that I want to ask about or just insert myself. So I'll turn it over to you. Thanks, Joe Feldman. Welcome.
Great. Well, first of all, thank you very much, Brad, for the opportunity to participate in your webinar this evening. And I'm delighted to have this opportunity to share a little bit of what I've learned over the course of the last several years with regard to insurance claims for wilderness therapy, as well as for other programs for family members, for adolescents, if not more broadly, understanding how insurance and mental health work. So with that, I'd like to share this headline: "Don't expect any help from your insurer." That's what a friend of mine told me just a short time, maybe a week or two after our daughter left for wilderness. And at that point, I actually hadn't thought much about insurance. I'd been thinking about our daughter moving into a program. It was a lot to wrap my mind around. And so when this friend said, "Don't expect any help from your insurer," it really focused my attention on a part of the process that I would learn quite a bit about over a period of time. But at the beginning, I was quite, I would say, overwhelmed and a little bit shocked with this introduction that my friend had for me. So if we want to go in with the assumption that you're not going to get a lot of help from your insurance company, which I think is sadly a reasonable assumption, then we have to turn to the question of what ideas can I share, or what wisdom, as Brad sort of teed up, what sort of wisdom could I offer to families who have children in wilderness or in other residential programs, perhaps, that, ideas that might be actionable to them, so that with a little bit of planning, maybe a little bit of work, you might at the end of the day find yourself with your insurance company paying for the claims that you're entitled to, both under the law and under your policy. So this evening, I'll talk about some actionable steps and some awareness that I think is important in three different categories. The first is a little bit about insurance policies and about the law with regard to mental health care and insurance coverage. The second is about available resources. And the third is I'd say a much more step-by-step practical series of ideas and suggestions that you might find through the process. Going back to the advice that this friend of mine gave me when he said, don't count on any help from your insurance company, it never occurred to me that the law was on my side, that there were lots of resources that would be available to me if I could only find them, and that a lot of the process I did have some control over as I managed the interactions between myself and our daughter and the insurance company. So let's take a first step in talking about insurance policies and the law. So I first should say that I'm not a lawyer, but I've learned a lot as a non-lawyer over the last several years. And what I've learned is that for a long, long time, there have been very significant efforts in Washington, D.C. and in state capitals around the country to impose on health insurance companies obligations that they treat mental health the same way that they treat physical health. That law at the federal level is referred to as mental health parity, and that law has been on the books for 11 years. A number of states in the meantime, have adopted very similar laws, sort of a belt and suspenders approach. Those laws, as a general matter, have the same guarantees. They say health insurance companies should treat mental health claims the same way they treat physical health claims. And that all sounds great. And it is great. It's really fantastic. Those laws and the regulations that support them have been largely bipartisan efforts. And over time, in fact, as the third bullet points out, health insurance policies are starting to include very specific provisions for how they're going to handle mental health claims. And that would include wilderness. It would include residential treatment. It would include certain outpatient treatment programs, sort of the whole gamut of mental health care. And the last piece of good news is, and I say this is good news if you're interested in getting insurance companies to actually follow those laws, is that over the course of the last year or so, some really significant lawsuits have been won against major insurance companies that have mandated specifically how those insurance companies need to obey the law and how they need to treat mental health care claims the same way they treat physical health care. So that's, as I've come to learn, sort of the way these things work. The laws are enacted. Sometimes they're immediately easy to comply with. Sometimes they're more complex. This is one where there's been a lot of complexity. And so it's taken some lawsuits over the last year or so to have slowly but surely made a difference in having health insurance companies respect the law. So here's the bad news. The bad news is that many families, ours included, encounter denials for their mental health care claims. Sometimes confusing denials. Sometimes the process is just like a maze. At the end of the day, denying is easy. You submit a claim, you get a letter from your insurance company, it might be called an explanation of benefits or something else, that says in one way or another, we're not going to pay. And you've got a lot on your mind, particularly when you've got a son or a daughter who's in a wilderness program or a residential treatment program. And so you take no for an answer. And that denial coming from the insurance company is really easy for them to say, to blurt out. And overcoming the denial may not be so easy to do. So what can you do about it? A few things, and I hope that these seem relatively easy to undertake. The first is to request a copy of your complete insurance policy. Typically, when you're buying a health insurance policy, the company will provide you with a summary of what the deductible is, what the network or HMO provisions are in terms of your selecting physicians and the like. And that summary is of course important to understand the very broad brush aspects of your policy, but it's not the whole policy. The whole policy could be 50 or 100 or 200 pages long. And in that detailed policy will be provisions that tell you exactly how mental health care claims are going to be assessed. That's something that, at least in my experience, is not in the summary. You have to request the entire policy. And by law, you're entitled to get that. You might be able to get that by asking your employer if your insurance is through work, or if you buy insurance through an exchange or through an insurance broker. Any of those, whatever your normal resource is for accessing insurance, they should be able to provide you with a copy of the complete policy. And then once you find that policy, you'll be able to find information there about how they handle mental health care claims. The second is to know what your rights are under federal and state law. I've described the headline, and in this case, I think the headline really is the most important, which is that under federal law in some states, mental health care has to be treated the same as physical health. There's a really terrific resource that I would recommend to you called don'tdenymeme.com. And that has information and links about state laws and state regulations for all 50 states. And, using that resource, you'll be able to find information about, your particular home state. Hopefully that would be useful to you. Don'tdenymeme.com is part of the Kennedy Forum. It's part of their national effort to provide information and support for all individuals who are trying to seek insurance coverage for mental health care and for addiction claims too. One other step that's not on this page that I think is potentially important is to talk with your employer if you do get your insurance through your employer. So your employer or the employee benefits person who works at your company, or maybe it's an outside company that does that work for your employer, tell them if you're having any troubles at all with your mental health care claims, and let them know about mental health parity. It's quite possible that they're not familiar with the law, even though it's been around for 11 years. It turns out that lots of people just never heard of it. Maybe people that should know something about it. So you might end up, talking to an employee benefits person who learns something new that's important for all the employees at the company, in that these claims should be treated the same as physical health. So use your resources at work if that's where your policy comes from, so that you might get some support there. In terms of some other available resources that you might tap into, let me discuss the 3 that are shown on this page. And I'll start in the middle with insurance claims advocates. So when this friend of mine said, don't expect any help from your insurer, he also said to me, by the way, a family member of his had some troubles with their insurance claims for some mental health issues. And he recommended that I contact a firm that is expert in filing claims and complying with all of the bureaucracy of an insurance company, and can help to file the claims for me and do it in a way that would be most likely to result in our claims getting paid. There are a lot of different resources available like this. I had no idea that this sort of business even existed, but it turns out there's enough insurance companies that don't respond to claims as they should, and so companies have found an opportunity here to work with individuals and work with families to help them file their claims and to do so in the proper way. So that's one resource that you might want to look into. In my experience, they're certainly not free, but the cost of these insurance claims advocates is relatively small, certainly relatively small compared to the cost of the treatments that are involved for wilderness therapy or residential treatment. So that's the first one. The third one is lawyers. So I certainly am not recommending that everyone go out on the first day and find themselves a lawyer and get ready to sue their insurance company. That's not, I don't think, a necessary thing that you need to worry about when what you're trying to worry about is whether your son or daughter is getting great care. But I would say it's something to think about for maybe down the road. It's certainly something that these insurance claims advocates think about all the time. They all have great experience with lawyers. And if you're interviewing an insurance claim advocate, you certainly would want to ask them about lawyers that they work with and what their experience is. It turns out there's a relatively small number of lawyers. I've been told the number is maybe 10 or 20 in the country who are really experienced with litigation related to mental health parity. And after all, it's only it's a relatively new law, and the number of cases that have been brought to court is relatively small. But the good news is these folks are out there. and I've had a chance to interact with probably half a dozen different litigators as I've been involved in meeting with legislators in Washington and here in Illinois. And the ones I've met are incredibly impressive, incredibly empathetic and sympathetic to the challenges of getting mental health care paid for by insurance companies. Let me talk a little bit about the first resource on this page, a trusted friend or family member. I call this a little help from my friends. I remember very clearly when our daughter went off to Wilderness, we had a real outpouring of support from friends and family. They knew it was a challenging time, and more than one, probably dozens, said to us, by the way, if there's anything that we can do to help along the way, please let us know. And although I didn't think about it at the time, those are offers that I think, many families get when their children are off particularly in residential programs. And it could be that some of the work that I'll talk about next in terms of the blocking and tackling of dealing with an insurance company might be better suited to help from one of your friends or family members. And I say that because there's a level of detail in the work. There's a level of what I would call from my professional life, project management, of keeping track of dates and times and conversations. And it could be that trying to do all that and trying to take care of yourself and take care of your family and take care of your son or daughter who may be away at a program might just be a little bit too much, but that having a family member who reaches out and has those sorts of skills, it could be that that's a great resource for you to take advantage of. And you might find it appropriate to say, you know what, I really could use some help with my insurance because it's just really complicated. So just to summarize when it comes to resources, consider asking a family member or friend for help dealing with insurance claims, and consider talking with or maybe hiring an insurance advocate or eventually a lawyer, a litigator who might be able to help. By the way, when if you decided that you wanted to have a family member or a friend help you, it's actually very easy to sign a paper that your insurance company would provide. It could be called a delegation of authority, could be called an authorization page. And it will say that, I, Joe Feldman, have agreed that my friend, Betty Smith, is empowered to talk to the insurance company on my behalf with regard to any of the claims related to certain periods of time or certain care. That's something that you can do, and that's something that will free that family member or friend up to be able to handle all the questions and to deal with those particular challenges. So let's talk a little bit about some of the steps that you might take, or maybe that one of your friends that you tap a shoulder and say, I want to get some help. What are some things that that might be helpful for you to do? So on this page, identify two things that really are important, I'll say, as you get started. That doesn't necessarily mean on the very first day, but towards the beginning, I think these are two things that are worthwhile to think about. The first step is to ask your doctor, or it could be your child's doctor, their psychiatrist, it could be a counselor, it could be a therapist or some other provider, to write what I call a medical necessity letter. So why is this important, and what is it? So it turns out that medical necessity is an extraordinarily important phrase when it comes to the laws around mental health parity. So if you break your leg, the medical necessity is that you have your bone set and you wear a cast and you might get some physical therapy. There's really not much doubt about it. And if you have some rash on your skin, you go to a dermatologist and they recommend a particular course of treatment. And the question about what's medically necessary is not really an issue. When it comes to mental health care, when it comes to addiction disorders, when it comes to complex issues that are often the case for young adults who are in wilderness or residential treatment, the medical necessity is more complex. And what I've come to learn is insurance companies are very quick to say, we're going to deny this claim because there's no medical necessity. And their definition of medical necessity may be very hard to sort of untangle. And that's why I recommend that you have, right from the get-go, the physician or the therapist who knows your child best, who knows your circumstances best, write a medical necessity letter. That letter would probably take the form of to whom it may concern. It would that physician or psychiatrist would introduce herself or himself and what their scope of their practice is, what their experience is, and then they would specifically talk about at a very high level why a particular course of treatment is, in their opinion, in their expert opinion, medically necessary. I've seen certainly more than one of these medical necessity letters. It's typically one page is plenty. It needn't be a recitation of all the details that led to their medical judgment about a particular course of treatment. In fact, I would say at some level, the more straightforward and simple, the better. The point is to document that in their professional judgment, based on their direct and probably their many contacts with the patient, they've made this judgment. And that's the most important judgment of all. It's the doctor who actually saw the patient. And having that letter in your hand may prove useful when the insurance company says, well, we don't think this treatment is medically necessary. The first course of action could be to provide the insurance company with a letter from the provider that says, in effect, well, actually it is. And our doctor says so and has written it here. It's really important. The second is to be mindful of requirements that might exist in the policy. For example, pre-authorizations. So earlier I mentioned that one of the important things to do is to get a copy of your entire insurance policy. That detailed policy may have information about required pre-authorizations or other processes. I would also add that sometimes those required pre-authorizations are illegal because they are not at parity with how the insurance company treats physical health. But that's a question for a lawyer. It's certainly not a question that I can answer, and it's very unlikely that that's a question that you, as a parent with a with a son or daughter in a program, is going to be able to answer. But having at least some awareness about what those requirements are, and to the extent that you can comply with those, and not get tripped up not having filed for a pre-authorization or the like, that's something to be aware of. By the way, when you go to the emergency room, you don't necessarily, in fact, I think as a general rule, you do not need a pre-authorization for an emergency. And it's certainly not uncommon for children who are, or young adults who are in wilderness programs, for their placements to be made on an emergency basis. So that's something that could very well trump a pre-authorization requirement. It's something that would have to be looked at on a case-by-case basis. Now let's talk a little bit about some of the recommendations that I would offer that are more along the way through the course of a treatment program. Could be through a series of residential programs, could be outplacement or a step-down program. And And the recommended steps are these. The first is to take really detailed notes of all of your contacts with your health insurance company. So by detailed notes, I mean the day and time of the conversation, who you talked with. Insurance company customer service reps are obligated to give you their ID number. That will help to document exactly who you talked to and what they said, and then to write down exactly what that person said, any promises that they made to you about following up on a certain date, or specific recommendations or instructions that they gave you about how to file claims. All those details are important. The accumulation of the notes that I kept with our insurance company turned out to be incredibly important. And I think without those detailed notes, we would not have been successful having our insurance company take the responsibility that they were obliged to take to cover our daughter's care. So take those detailed notes. You'll be glad you did. The second is to leave clinical questions to the clinicians. So what do I mean by that? In my experience, the customer service reps that insurance companies put on the front line are very often friendly and they try to develop a rapport with the with people who are calling in, and they might ask questions like, "How's it going? How's the treatment? Is it working well? How's your daughter doing?" In my case, one of the questions that they asked was, could you say on a scale from 1 to 10, how you think your daughter is doing? Those are all questions that are completely inappropriate for a customer service rep to be asking. And they could be used, the answers that you give could be used against you if you were to say something like, I think she's actually doing quite well, or I think she's improving. And while your responses may be well-meaning and you might appreciate sort of a friendly voice on the other end of the line, I would encourage you to just say politely, I'm just going to leave that to the doctors. It's very simple. It's really an inappropriate question for a customer service rep to be asking. The last recommendation is to watch out for what I would call red flags through the claims denial process. So if you submit a claim and it's denied, look for exactly what the reason for the denial is. Sometimes those show up on an explanation of benefits. They may be coded with numbers. At least in my experience, they don't say very much, and it may be appropriate when the denial comes in to call the insurance company and to ask them for information about the denial. And if it's necessary, to ask to speak to a supervisor and to request, maybe even in writing, a request for an explanation of why a particular claim was denied. Those denials may or may not make sense in light of the insurance policy, and they may or may not make sense in light of the medical necessity that the doctor determined was appropriate based on their assessment of what sort of care was needed based on the status of your son or daughter. And it also may not make sense in light of the mental health parity laws, which say they have to treat mental health the same as physical health. So there's a lot of different reasons why those denials may be inappropriate. And I hope that at least some of the discussion that we've had so far this evening might help you to identify red flags that lead you to think, there's something about these denials that just doesn't quite make sense, and that maybe I need to follow up. So as you think about insurance coverage for mental health claims, I think one of the most important steps, and one that I came to realize the importance of later than I would like, is to remember that you are not alone. There are an incredible number of resources that are available to you, some in the form of insurance advocates, some in the form of litigators or lawyers who can help you. And certainly there are a lot of um, policymakers in Washington and across the country who are working to make mental health care accessible and covered under insurance policies on a national basis. I'd mentioned earlier the website don'tdenyme.org. That's, I think, a terrific resource. An article that I wrote that describes some of these steps and maybe some others as well can be found on the website thekennedyforum.org. That guest blog is entitled 10 Steps to that should be securing insurance coverage for mental health care. And in terms of finding help with claims advocates or litigators, a Google search can likely get you in touch with someone in your city or in your state who might be able to help you with filing a claim, maybe with filing an appeal, and helping you, frankly, to gain access to the insurance coverage that you bought and that the law requires that you be provided in support of getting the care that your son or daughter may need, or maybe some other family member or someone else that you care about that maybe without insurance is just not available.
Thanks, Joe. I'm going to read to you some of the comments and some of the questions. I shared with all of you the fixmyclaim.com. That's one insurance advocate that we have here in Utah. There are many, and the directions you've given families to search are great. I know that this company, www.fixmyclaim.com, which is denials management, and they do charge a fee, like you said, but they have a lot of experience with wilderness therapy specifically. Couple of comments before I get into the questions. Somebody just wanted to thank you for the wonderful new information about insurance claims advocates. Somebody else also was very grateful for the idea of asking a trusted family and friend, because that's something that that so many people get offered, and I think that's an amazing idea. Couple of the questions that have come in, and this one may have already been answered because it was asked very early on. Somebody asked before we even started, I'm in the process of the appeals process with Regents. Any tips? So I don't know if you have to add anything to what you've already said to that question. Maybe it was covered throughout, but that was the first question.
Sure. So I can comment based on our experience. We filed 3 different appeals through the course of our I'll say battle with our health insurance company. The appeals that you would file based on the instructions that come from the insurance company are probably shorter and less likely to be successful than ones that are filed with with an advocate that can help you to file the appeal and make reference to not only your particular case, but also to other cases that they may be aware of, either with that insurance company or with other insurance companies. And so that may bolster the, I'll say, strength of your appeal. I know I've run into people who have filed their own appeals. I've run into people who've actually tried to file their own lawsuits. I think the complexity is really, really dramatic. And so I think, with the appeals process, I think looking for an outside resource would be highly recommended. I think also, some of the recommendations that I talked about in terms of documenting conversations with insurance companies, the reason to document all those contacts is to be able to include in an appeal all of the guidance that you got. I wouldn't be surprised if the guidance that you get from your insurance company varies every time you talk to a different customer service rep. But having all of those documented interactions can be extremely helpful. So that's, I think, all I would have to say about the appeals process for the moment.
And the thing I want to say, Joe, that before I read the next question is, as a professional, I have found in working with insurance companies that they're looking to deny. When I've made the mistake as a professional early in my career to discuss the progress that a client was making on my caseload, that was used as a reason to cease benefits in our program. Like you described earlier, leaving the question to clinicians because it took me just a little while in the process to realize I couldn't say anything too good about my client, even if I was very optimistic about the course of treatment. I still wanted to and had to make a case for medical necessity, which was still present. So thank you for that. Another question has come in that says, my policy had a specific exclusion for wilderness therapy. Any likelihood that my appeal would work?
So I think, so again, this is probably a question more for attorneys, but let me make a few comments. So first of all, this is an example of a kind of exclusion that the lawsuits have not yet completely caught up with in terms of how to apply parity law. So there's not really a physical health analogy that you could point to that's like wilderness therapy for certain mental health care treatment. I may not have said that elegantly, but the point is, when it comes to wilderness, there's a growing body of evidence that wilderness therapy is effective, and insurance companies have seen lawsuits go against them where wilderness therapy is the appropriate medically necessary treatment, and therefore they're obliged to pay. It has caused insurance companies to add exclusions for wilderness therapy, and I think the likelihood of an appeal working is probably very, very low, because the insurance company on appeal will simply say there's an exclusion, and so we're not going to cover it. So that's something that would have to go to probably would have to go to a lawyer and have to be the subject of a lawsuit. I think this is an area that's more likely to be helpful to parents that have kids in wilderness down the road than necessarily today. But I would certainly recommend reaching out to attorneys who are active in this area, because I think that is going to change, and there are going to be lawsuits that are found against insurance companies that say exclusion for wilderness therapy is not appropriate and it's not legal. So I think appeals are going to be tough. Lawsuits, I think I'm over time a little bit more optimistic.
And there have been, like you said, some high-profile cases where insurance companies were across the board denying wilderness care, even some class action suits that have been won and had been publicized. The other thing I will tell you is, this is even since you were involved, Joe, I think, is that now wilderness therapy has its own CPT code. So we have our own mental health code now as part of the body of insurance codes that you can submit. So you can hear that progress being made. And again, referring to a professional to answer complex, detailed, nuanced questions like that would be recommended.
Absolutely.
This question is probably for me. It says, did I read that Evoke has an insurance associate to help with claims? We do have somebody in-house. It's not going to be at the level that one of these insurance advocates is going to do. Ours will provide you with the information, give you some basic direction, provide you with billing resources to submit to your insurance company, and some minimal guidance, but it's going to be more involved than that. We're going to guide you in the right direction generally, but once you bump up against some of the things that Joe's talking about, you're going to need to follow the directions that Joe's been giving you tonight, all of the advice.
So if I could jump in, I think from my experience, the Evoke insurance contact was very helpful in working with our insurance advocate to be sure that the right insurance claim numbers. So there wasn't a CPT code at that time, but there were other insurance codes that were important. It was important that they appear on the invoices, and the insurance advocate was able to interact with the insurance advocate at Evoke to say, let's be sure that the care that's being provided is being documented in a way that the insurance company is going to see it and recognize that it's appropriate to the specific medical necessity.
Thanks, Joe. Next question that comes in, it says, I worked with the health insurance advocate and received a partial reimbursement followed by a denial. I was informed that if I pursued the claim further, the reimbursement I received could be reclaimed by the insurance company. Is this typical of an insurance company and an insurance advocate?
Well, I think the first thing I would have to say is that in this world of filing insurance for mental health care, whether it's wilderness or otherwise, in this world, there's nothing that's typical. It's very difficult to point to any one thing that you can count on consistently. I have heard of instances where claims were paid, and then the insurance company came back later and said, "Oh, wait a while. The care for that last month was actually not medically necessary, and therefore we're going to request a refund." I think, as a parent, this is just it's just insidious, and I think it goes back to having an insurance advocate on your team. I think that's something that is recommendable, and potentially having a litigator identified who might be able to help you with this sort of this sort of scenario. The denial scenario that Brad talked about a few minutes ago, of insurance companies being very quick to deny and having a lot of different sort of reasons at their disposal is really challenging. Two that I find interesting and that I've encountered are your daughter is not making enough progress, therefore the treatment is no longer appropriate, or your child is making so much progress that we're going to withdraw the treatment because it's no longer necessary. So those were in both of those cases, that conclusion about medical necessity was wrong, but it's certainly one that the insurance company very easily could make and lead to a no that we would have to overcome later.
And I received that kind of feedback on cases that I work with on the same client back-to-back weeks. It's a real tightrope to walk for us clinically. Another question that comes in says, do you know if undocumented patients who have county insurance would have equal protection for mental health parity?
I think I'll have to defer to the lawyers on this one. I really can't comment on how undocumented patients and public insurance programs work. I'm sorry.
Thanks, Joe. I'm going to go over some of our upcoming event slides, and then we have another slide at the end for if you have any live questions that come in. Our parent workshops, here's the schedule for the next 4 months. So this is a workshop that we recommend for all parents if possible. You can come out and combine this with a parent visit. It doesn't have to be combined with a parent visit to the field to see your child, but it can be that way if the timing works clinically for you and your family and your child. So, and we alternate between our Oregon program and our Utah program. So talk to your therapist about what might work best with you. The next few coming up are December 7th, January 25th, and February 15th. So those are on our calendar, and I wanted to share those. RSVP or ask any questions to Melanie at evoketherapy.com. One more parent support group that I'll be running before the end of the year, and that's in Southern California, the Los Angeles area, and the South Bay area. That'll be this Sunday, December 1st, 3:30 to 6:30. Limited space available, so RSVP or ask Melanie at evoketherapy.com for more questions. Email her. I can't say strong enough about how I feel about our intensives. I think it can be the most powerful thing you do for yourself, for your marriage, for your relationships, and for your children. Our December Finding You is closed. These are starting to fill up now more and more quickly. And so we're going to start doing 2 a month if that's the case. January is already filling up. The next date is January 8th, February 19th, and March 4th. These intensives can be for couples, customized for families, professionals, or individuals. For more information, email intensives@evoketherapy.com. Like I said, something I do, something everybody in my family does, something we even pay for our clients, our employees to go through the process. Not in ours, of course, but in somebody else's, very similar. Evoke also has a pursuits program if you think of family fun with a light therapeutic component, or young adults. I even did it with my my own adolescent child, where they went on a 30-day service trip to the Dominican Republic, which they still talk about glowingly. In fact, wrote about it in their college essay this year. We ask all parents to go to at least 6 12-step support groups, any combination of Al-Anon, CODA, Families Anonymous. Adult Children is a group that if you feel like perhaps that your childhood growing up was especially traumatic, or you just want to learn about what it's like to grow up in an alcoholic family or a family where there's mental illness, adultchildren.org is a place to go for that. Alateen.org is for teens. Refugerecovery.org is a Buddhist-inspired recovery program, less of an emphasis on a higher power. NAMI.org you can go to for free support in your local community with the local chapter. All of these broadcasts are available on the podcast app around 24 hours after the original airing. You can go to your iPhone or iOS device and use the podcast app. On any Android device, you can use the SoundCloud app, or on your computer, you can go to soundcloud.com. On Twitter and Instagram, you can find us at Evoke Therapy Programs using the handle at Evoke Therapy, or you can find the Summit Lodge on Instagram using the handle at Evoke Summit Lodge. On Facebook, you can find us by searching Evoke Therapy Programs. Also, we're coming to the close of this invitation, but we need more people. They need more people for the Alumni Foundation. This is an organization that helps raise money for people who can't afford therapy. So if you want to give back, if this is a skill set, an area of your skill set, please reach out to them on Facebook by searching Evoke Family Foundation. And then, of course, our blog is available with new content each week. My book, The Journey of the Heroic Parent, is available on Amazon, or you can also get an Audible version there. If you go to the Parent Alumni Foundation book page on Amazon, through the Amazon Smiles program, a percentage of the proceeds goes to help people who can't afford therapy. Looking for any more questions that have come in? I just have one big thank you that has come in. I have one more question. It says a couple more questions. I know that Evoke has a relationship with denials management. When is the best time to reach out to them? Before I submit a claim, when the claim is denied, or other? Joe, I don't know if you have that, because I think that they wouldn't be that different than any other advocate. So maybe I'll throw that question over to you. When's the best time to reach out to an advocate?
I would say as soon as you pick up the phone and call them, they will be ready to help you with claim number 1. I would get started right away.
I would have guessed that too, Joe. They will help you not make some of the mistakes that you could unknowingly make in the early parts of the process, just to better your chances.
Absolutely.
Then another question comes in. What is your experience with reimbursement for therapeutic sessions versus payment for the entire program? I can speak to that in general, Joe, and I don't know if you want to add something. We definitely have more success with the individual sessions being reimbursed. That's something that it's going to be a larger number for the insurance companies. So sometimes they're willing to pay for that without a lot of effort on your part, because they believe that if they do that, then you won't try to make a claim against the entire stay or a larger percentage of the stay in Woolers. I'm not saying that I suggest that you just stop there. I love all of Joe's ideas, and I love the idea of contacting an advocate and sharing your case with them. But we do have more success with that in general, and I think it makes all the sense in the world for the insurance companies to pick that up on the front end, an out of network per session reimbursement. Do you have anything to add to that, Joe?
Yeah, so it's certainly easier for insurance companies to say, out of the thousands and thousands of dollars that you're paying for a residential program, we'll pay for that 1 hour in the morning and maybe another hour tomorrow afternoon, and the rest of it is not covered. That's where an insurance advocate can really help a lot. Brad, you just touched on one thing that I'd like to add. This whole challenge of dealing with insurance companies is not going unnoticed by a lot of people who are investing in mental health parity. And a report was just published last week by an organization called Milliman. And they said that particularly with adolescents and they're accessing mental health care that they need, that it is 10 times more likely that they're going to have to go out of network compared to physical health. So that's a huge problem. It's also an indication, and this report cites it, that networks are simply too small. They don't offer enough options, They don't offer the diversity of options that might be appropriate to medical necessity, and insurance companies need to take up their game. So, it's really through more claims being filed with the backing of advocates, with medical necessity letters, and sadly more lawsuits being fought and won, so that this pioneering trail can open up and people can have access to the care that they need and that they need for their families.
Thanks, Joe. Thank you, Joe, for reaching out to me and offering your wisdom, the wisdom that you gained through your process, to all of our families. We really, really are grateful for that, for you giving your time and your energy to this project. I also want to share with those of you listening on the podcast app that Joe has also created an email just for answering questions. So if you have questions and you want to reach out to Joe, you can go to joe.insurance.parity@gmail.com. Once again, that's joe.insurance.parity@gmail.com. So thank you again, Joe, for your generosity in sharing this with our families.
Thank you, Brad.
So switching gears back to the clinical side of things, we're going to be talking about something a little bit more provocative next week clinically than I usually take on. I'm going to be talking about gaslighting, parenting, and the narcissistic wound. I actually posted something about this recently on one of my social media pages, and it was one of those posts that I suppose was controversial enough that people started arguing with each other in the comments. So I thought it was something that I could present here in a way that could make sense and be really inclusive to all the people that were coming from different perspectives. So I'll be talking about that, gaslighting, parenting, and the narcissistic wound next week. Hope you all have a meaningful Thanksgiving while you're with us. If you're still with us, and if you're at home, I hope it's a joyous time for you and your family while you're home, while you're all together. This next webinar that I just described, this next broadcast, will be December 4th, 2019 at 7 p.m. Mountain Time. So I'll talk to you then. Thank you again, as always, for joining and investing in this process for you and for your family, for your child. Take care, and I'll talk to you next time. Bye-bye.